Hello, and welcome to the channel, your trusted source for real, science-backed health advice made specifically for men over 60. If you're someone who values practical solutions, no-nonsense explanations, and honest information that respects your experience and stage of life, you're in the right place. Today, we're diving into a topic that doesn't get talked about often, yet it quietly impacts millions of older men across the country. It's not about medication, diets, or surgeries. It's about something far more personal, your private habits, and how those habits can start to affect your health in ways you may not even notice. You see, many men continue certain routines well into their 60s, 70s, and beyond. Habits they picked up decades ago, back when their bodies were younger and more resilient. But the truth is, what worked in your 30s or 40s might now be putting strain on your heart, your prostate, your pelvic floor, and your nervous system, slowly, silently, and without any obvious symptoms at first. Most men are never told this, and even fewer know how to spot the warning signs before real damage sets in. That's why in this video, we're going to walk through 7 common mistakes men over 60 often make during self-pleasure, mistakes that can lead to discomfort, loss of sensitivity, and even urinary or sexual health issues over time. But we won't stop there. We'll also look at doctor-recommended corrections for each one. Realistic, discreet changes you can make that are backed by medical research and years of clinical experience in men's urology and sexual health. So, if you're ready to take a smarter, healthier approach to this very private part of your life and feel more in control of your health, energy, and confidence, stick with us. You might be surprised how much of a difference just a few small changes can make. Let's get started. Section 1. The hidden health risks of common habits in men over 60. As we age, even familiar routines can start to have unintended consequences, especially when it comes to habits related to self-pleasure. What once felt harmless or even beneficial can begin to affect the brain, blood flow, nerve function, and prostate health in subtle but meaningful ways. Let's break down 3 of the most common but overlooked mistakes older men make, and what you can do to correct them safely and effectively. Mistake number 1. Relying on adult content for stimulation. What happens? Over time, consistent use of high-intensity adult material, especially videos with rapid edits, extreme visuals, or endless novelty, can overload the brain's dopamine system. This system is responsible for feelings of motivation, reward, and pleasure. Why it's harmful. In your 60s and beyond, your brain becomes less flexible and more sensitive to overstimulation. When you repeatedly flood it with intense visual content, your brain adapts by dulling its response. That means the pleasure you once experienced from real-life intimacy, even just light touch or connection, can feel flat, less exciting, or even emotionally disconnected. Over time, this leads to reduced arousal during partner intimacy, decreased sensitivity and pleasure, a gradual decline in natural libido, emotional withdrawal from real relationships. What's worse, many men blame age, when the real issue is neurological fatigue caused by years of overstimulation. Solution: try stepping away from screens. Shift to slower, imagination-based stimulation or gentle memory recall. This helps recondition the brain, rebuild natural arousal patterns, and improve overall emotional satisfaction. Consider this a dopamine detox, a break to help restore balance and regain pleasure in more natural forms. Source: Journal of Sexual Medicine, 2015. Chronic overstimulation from pornography can cause desensitization and delayed ejaculation, particularly in older adults. Mistake number 2. Sitting on the toilet during self-stimulation. What happens? The bathroom may seem like a private, quiet space, but sitting on the toilet, especially in a hunched position, compresses the lower abdomen, restricts circulation, and can place undue pressure on the prostate and pelvic nerves. Why it's harmful? This posture can silently disrupt pelvic blood flow, which is vital for healthy erections, prostate drainage, potentially increasing inflammation risk, nerve function, especially in the lower back and groin, bladder efficiency, leading to incomplete emptying or post-urination dribble. Over the years, this repeated pressure can contribute to symptoms such as groin discomfort, weak urine stream, difficulty getting or maintaining an erection, lower back tension related to pelvic floor dysfunction. Solution: change your environment. Opt for a more upright or reclined position where your hips and pelvic region have room to relax. Even lying back in bed with supportive pillows can reduce strain on internal organs and promote healthier blood circulation. Your pelvic health and prostate will benefit greatly from this simple shift. Source: American Urological Association, AUA. Research shows pelvic compression impairs blood flow and may contribute to sexual dysfunction in aging men. Mistake number 3, rushing the process. What happens? In today's fast-paced world, many men, especially those who've grown used to quick and quiet routines, treat self-stimulation as a brief task to get over with. This habit may stem from years of stress, privacy concerns, or emotional detachment. Why it's harmful? Rushing triggers the sympathetic nervous system, also known as the fight or flight response. This causes tightened muscles, restricted blood vessels, elevated heart rate, shallow breathing. Instead of calming the body, this approach creates tension, limiting the release of key pleasure hormones like oxytocin for connection and bonding, dopamine for motivation and reward, serotonin for mood and satisfaction. Men may still climax, but feel drained or emotionally flat afterwards because their nervous system never had a chance to enter a restorative, relaxed state. Solution: give yourself time, breathe deeply. Slow down and allow the experience to unfold gradually. Focus on mindful touch, deep breathing, and presence. This allows your body to transition into a parasympathetic, rest and recover state, maximizing hormonal benefits, reducing stress, and restoring emotional connection to your own body. Source: Harvard Health Publishing. Controlled stimulation and slow arousal patterns increase parasympathetic activity and promote hormonal balance in older men. Mistake number 4, neglecting the pelvic floor. What happens? Most men have heard of core strength, but few realize there's an entire group of muscles, the pelvic floor, that plays a crucial role in urinary control, erectile function, and overall sexual satisfaction. These muscles lie deep in the lower abdomen and act like a supportive sling for the bladder, prostate, and sexual organs. As we age, this muscle group naturally weakens, especially after decades of sitting, stress, inactivity, or poor posture. The result? Leaking urine when coughing, laughing, or lifting. Increased urgency or nighttime trips to the bathroom. Decreased firmness and staying power during intimacy. A reduction in orgasm, intensity, or control. Why it's harmful? When the pelvic floor is weak, your prostate and bladder lose their support. Pressure builds in the wrong places. Blood flow drops. And nerves may become compressed or underused, leading to a gradual decline in both function and sensation. Worse yet, most men never make the connection. They assume it's just part of aging, when in fact, it's often a preventable, reversible condition. Solution: start with simple pelvic floor, Kegel, exercises. While seated or lying down, gently tighten the muscles you'd use to stop urination midstream. Hold for 5 to 10 seconds, then relax for the same amount of time. Repeat 10 to 15 times per session, 2 to 3 times per day. With consistency, these exercises can reduce leakage, improve erection quality, and restore control, often within a few weeks. Source: Mayo Clinic. Pelvic floor strengthening is proven to reduce urinary incontinence and support erectile function in older men. Mistake number 5, too much or too little activity. What happens? Some men worry they're doing it too often. Others have stopped altogether due to health changes, medication, or just not feeling the same. Both extremes can create health issues, not because of morality or judgment, but because the body needs balanced stimulation. Why it's harmful? Too much activity, especially if it's compulsive or used to escape boredom or stress, can lead to fatigue and energy, depletion, irritated prostate tissue, loss of sensitivity over time, decreased interest in partner intimacy, too little activity due to shame, medication, or fear of aging can cause, decreased blood circulation to the genitals, nerve atrophy and reduced erectile responsiveness, lowered testosterone levels, a drop in overall desire and motivation. Remember, sexual health is a circulatory and muscular system, just like your heart or legs. If it's inactive for too long, it begins to weaken. Solution: aim for a moderate intentional frequency, about 1 to 2 times per week, depending on your health and comfort. When done with care and awareness, it promotes hormonal balance, supports cardiovascular and prostate health, maintains physical responsiveness, reduces anxiety around performance. It's not about strict rules, it's about finding your rhythm and listening to your body's signals. Source: Cleveland Clinic. Moderate, regular sexual activity supports cardiovascular, prostate, and mental health in aging men. Mistake number 6. Using excessive pressure or force. What happens? As sensitivity declines with age, many men instinctively increase pressure or grip strength during self-touch in an effort to feel more. Unfortunately, this well-meaning adjustment can do more harm than good. Why it's harmful? The skin, nerves, and blood vessels in the penis become more fragile with age. Using too much pressure can cause microtears in the skin, loss of elasticity and skin thinning, scar tissue buildup, which may lead to curvature, Peyronie's disease, reduced blood flow, resulting in difficulty maintaining an erection, chronic pain or numbness during arousal or after climax. This type of nerve and tissue damage doesn't happen overnight. It builds slowly, and many men don't notice until sensitivity has already dropped significantly. Solution: use a gentler touch. Avoid rough surfaces or objects. Never force an arousal response. Allow time for arousal to build naturally. Use lubricants as needed to reduce friction. Gentle stimulation not only preserves nerve health, but it also encourages more mindful, connected experiences, essential for long-term sexual vitality. Source: International Society for Sexual Medicine. Excessive pressure is linked to penile tissue injury, curvature, and nerve desensitization, especially in older populations. Mistake number 7. Disconnection. No emotion, no intention. What happens? For many older men, self-touch becomes robotic, rushed, or emotionally empty. Not out of choice, but habit. It's just something to do, rather than something to experience. Over time, this lack of presence can erode both physical and emotional satisfaction. Why it's harmful? When there's no emotional engagement, the body and brain don't release the full range of beneficial hormones, like oxytocin, which promotes bonding, and calm endorphins, which relieve pain and improve mood. Dopamine, which increases motivation and focus. Instead, men are left feeling disconnected from their bodies, unsatisfied even after climax, unmotivated in other areas of life, emotionally distant from partners. Over time, this contributes to depression, anxiety, and lower self-esteem, even when the physical function is intact. Solution: shift the focus from performance to presence. Approach self-touch as a moment of self-respect, care, and emotional reconnection. Light a candle. Breathe. Listen to calming music. Think of it not as just a release, but as a way to check in with your body. And remind yourself that you still matter in every way. Even solo touch can be affirming, healing, and meaningful when approached with intention. Source: National Institutes of Health, NIH. Emotional presence during sexual activity boosts immune function, emotional health, and overall satisfaction in older adults. Section 2. Why these habits matter. Now more than ever. By the time we reach our 60s, 70s, and beyond, our bodies operate under a different set of rules than they did in our 30s or 40s. The systems that once ran on autopilot, like circulation, nerve signaling, hormone regulation, and pelvic muscle tone, now require more thoughtful attention and care. Your nervous system may respond more slowly. Your muscles, including those in the pelvic floor, may weaken. Your prostate, after years of use and exposure to inflammation, may become more sensitive or enlarged. And while your desire for intimacy doesn't vanish, the way your body expresses and supports that desire changes. That's why these common private habits, ones that once felt harmless or even helpful, can quietly begin to undermine your long-term vitality. They may lead to diminished sensitivity and arousal, chronic groin or lower back discomfort, urination issues like dribbling or urgency, emotional withdrawal or loss of self-esteem, reduced connection with your own body or partner. And because the symptoms often show up gradually, they're easy to dismiss, until one day, something just doesn't feel right. But here's the good news. You are not powerless. With simple, informed adjustments, you can restore healthy blood flow, reactivate underused muscles, support prostate function, rebuild natural sensitivity, improve emotional satisfaction, and most importantly, regain confidence and control over your most private self. This isn't about giving things up. It's about learning a better way forward, one that works with your current body, not against it. Remember, good health at this stage of life doesn't mean doing more. It often means doing less, but doing it better. Small changes, when done with intention and consistency, can produce meaningful results. You deserve to feel strong, connected, and fully alive at every age. Call to action. Final 30 to 60 seconds. If this video gave you something to think about, or helped you understand your body in a new way, type yes in the comments. Or if there's a specific topic you'd like us to explore in a future video, like prostate health, urinary issues, or hormone balance, let us know. We read every comment and shape future content around what matters most to you. And if you haven't already, now is the perfect time to like this video, subscribe to the channel, turn on notifications so you never miss science-backed, age-appropriate health guidance made just for men over 60. Your health doesn't retire, and neither should your vitality, your independence, or your right to feel fully alive in your body. We'll see you in the next video. Until then, stay strong, stay informed, and stay connected to what matters most.